Hi, everyone. Welcome back to Stories and Conversations. And this month, we are talking about a very interesting topic, digital healthcare. And from my previous episodes, I've mentioned that I'm really passionate about healthcare and not just healthcare, but accessibility to affordable healthcare. And what I believe is digital healthcare is one of the key proponents to actually address the gap in accessing affordable healthcare, not just here in Kenya, but for the rest of Africa. And as I mentioned before, I will be having guests to talk about this particular topic to demystify what digital healthcare is all about and what impact they would like to see in not just in this market, not just in the Kenya market, the healthcare industry in the Kenyan market, but also for Africa. So, guys, please welcome my guest today. I have such an amazing guest. She's a digital health specialist. She's been in this space for a while. She'll tell us how long and why she's in this space. So, guys, help me welcome Dinah. Dinah, welcome to the show.
Thank you very much, Rahel.
How are you? How do you feel? How are you
I'm
today?
okay. I'm very happy. Thank you
Uh-huh.
so much for inviting me to your show. This is a very huge honor. I'm happy to be here and hi to everyone who is listening to us today. So, you asked me to introduce myself,
Yes, please.
and I'm happy to do that. My name is Dinah Mwangi, and like Rahel said, I am a digital health specialist. I have been in this space for the last decade in various capacities. And just like Rahel, I'm very passionate about health, especially in matters involving access and affordability. And so, yes, I'm very passionate about digital health. And over the years, we've been able to go to like really remote parts of this country and interacted with those patients who are in, very remote places where they don't have access to hospitals, they don't have a doctor nearby. And every time I go to these far-flung places, I always see the value and the application of digital health.
Oh wow, you've already started making this conversation very exciting, and I really love hearing that you're not just doing whatever you're doing is not just for people living in urban areas or you know for specific people, but it's for the mass market for everyone. Yes, because healthcare is a
Yes,
need and
actually,
mhm,
what I've noticed is that the people in the remote places need something, which is
yeah,
access. The
mhm,
people in urban areas are looking for convenience. So, for instance, you're
mm,
a mom, you're sitting in the office, and then your nanny tells you the baby is having a fever. And
mhm,
maybe you have this meeting that you cannot get out of, and you wish that you would just be able to get paracetamol into the house, take your 1 hour meeting, and then go and take your baby to the hospital. So that matter of convenience. And so what we found is that through digital solutions, such a mother is able to quickly order that paracetamol, get it delivered to their house, go to their meeting, use their lunch break to take the child to the hospital. But what we are seeing in other places now, say like Trans Nzoia, deep in the interior places, it's not about convenience. These people are working for hours just to find not a specialist doctor, but a nurse who can help to diagnose and help them to access medicine. Yeah, so that's what I've seen, Rahel, that the people in the remote areas are looking for access. And then the urban dwellers who are, educated
mhm.
people with careers, they're looking for convenience. You're trying to not sit in traffic jam, moving from Westlands to go to town to pick a prescription. You're looking at how can the prescription get to me in Westlands. Yes.
Wow, you're already getting into the conversation, and I really love it. But before we go so far, you are introducing yourself, but I still want to know, like, are you a mom? What other things are you passionate about? Tell us about
Yeah.
Dinah, a little bit more about Dinah and who Dinah is all about.
I love that, Rahel. Most of the times I just go like I'm Dynamo Monkey. This is what I'm passionate about. And I
Yeah,
just
because
give
you're
over
you're you're more
everything else.
than yeah, you're more than your career and what you do. So I'm sure there are other things
Exactly,
that you're really passionate
exactly,
about and would love.
exactly.
Yeah. So tell us.
Yeah, I'd love for people to get to know me a little bit more. Number one, I'm a happy human being. That's
Yes,
one
you
thing
are.
about me. I tend to be very jovial, very
Mhm.
chatty, very talkative. And I am married to one amazing Bernard Dazakere. I have two children. I have a daughter, Koki, who is 5 years old, and a son, Andre, who is 4 years old now. And I'm passionate about ice hockey. We are passionate about ice hockey as a family. And actually, we helped to build ice hockey in this country from scratch, all the way to
Wow.
having a national team and having a federation and playing tournaments abroad. So that's like my passion and my family passion.
Wow, ice
Yes.
hockey and digital healthcare. So what a
Yes.
combination. But
It
that's very
is. It's
interesting.
quite a
And that's
combination.
why, yeah,
Yeah.
and that's why sometimes you need to find other passions apart from what you do in your career. So I'm really glad you're here, Dinah. And I know this conversation will be very interesting. And you've already started making it a little bit interesting, talking about, how everyone requires healthcare in specific ways. So for the urban areas, it's more convenient. And then for
Mhm.
rural areas, it's actually a need, and they don't have access to, proper
Mhm.
digital healthcare, not even digital healthcare in general, primary healthcare. They do not have access
Just
to
accessing
primary
it.
healthcare,
Yeah.
yes, and it's
Mhm.
very, very important. So maybe before we continue, what is digital healthcare to you? How can you define, or what's your definition of digital healthcare according to Dinah?
So according to me, like not what I've read in all the publications, but
Mm,
according to me, digital health is any healthcare that you're accessing through a device, like a mobile device or a laptop or a tablet. It's you not having to go and access healthcare physically, but access health services electronically or digitally, if I can put it that way. Yeah, so we are looking at me being seated in my house, and through my phone, I can be able to access a pharmacy, a lab, a doctor, imaging services, whatever it is that I need. So that's my small definition. Of course, we do go to the depths of talking about m-health, which is mobile health, e-health, which branches out into things like electronic health records and the portability of those health records. But just for anybody who is listening in, is to understand that digital health is accessing healthcare from wherever you are through a mobile device or an electronic device, which includes even SMS, chat, WhatsApp.
yeah.
As long as you're not physically porting yourself to a doctor to see them face to face, you're accessing the healthcare through a device.
Yeah, and I couldn't agree more. So, Dinah, I mean, you've been in the digital healthcare space, you said, for 10 years. So how did you get into this
Yes.
space? And let me tell you why I'm asking this question. For me, I've come to interact with digital healthcare in the last, let's say, 4, 5 years. And then when COVID hit, it became such a huge phenomenon. Everyone was just talking about
Yes.
digital healthcare. Everyone wanted to move
Yes.
from, the legacy system, the old systems, to digital healthcare, especially for the
Yeah.
healthcare stakeholders, so insurance companies, the hospitals.
Mhm.
And I mean, it became really a big thing right now during the COVID era. But previously, it was not that big, or rather, I was not privileged, or I was not in a position to actually interact with digital healthcare. So, how did you
Mhm.
get into this space, the digital
A
healthcare
decade
space?
ago.
How
My
did you
story
get
is
into,
quite
yeah, and why?
interesting.
Yeah.
Yeah. So I actually, back in 2013, had an opportunity to go on a fellowship program in the United States of America in Washington, D.C. And when I was on this fellowship program, I was always attending a lot of events. And I attended an event that had startup founders. It was quite eye-opening for me. So I was actually on a fellowship for something very different, which is my work in civic engagement. But then I started hearing about health tech, and met a founder who was doing a program in Cameroon. Then I was like, okay, how does this work? And he's talking about, doctors in Cameroon getting support from doctors in America. And I was so interested in this. And so during that time when I was on my fellowship and attending events, I started thinking, well, this is like a really interesting space. Actually, my background is I started my career as a medical representative at GlaxoSmithKline.
Oh,
And
wow.
for those who don't know what med reps do, med reps are the people who, I say,
Mhm.
we are the cogwheels of healthcare. We
Yeah.
work for pharmaceutical companies, but we interact with doctors, giving them updates about medications. Like for us, we would do a lot of work with doctors, telling them what are the resistance patterns for antibiotics, what should you give for what indication, what are the dosages and the contraindications. So med reps are an allied part of healthcare that's not spoken about much, but that was a job that I really enjoyed, and I was at it for close to 5 years. And it was when I was in GlaxoSmithKline that I got invited for this fellowship. So first in that fellowship, I got introduced to startups. See, I started my career in a very proper British multinational company that was very structured and very organized, and the roles were
Yeah.
very, like I say, vertical. And you had your job group and your JD, and there's what you were doing, in the
Mhm.
context of a team. But then here were startups, and they were very horizontal. I was like, this is so different. I love it. Like, obviously, like in a multinational, you cannot just like walk up to your GM's office and start a conversation because things are very horizontal and structured. But in startups, it was like the founder, the who, you're all at a coffee table talking. I was like, I love it. This is what I want to do. I want to get into the startup ecosystem. So I said, okay, how do I now branch out from being a med rep? How do I become a digital health specialist? And I was in conversation with a friend of mine who was a student at Harvard. And he mentioned, oh, I have some friends who are coming to Kenya and they're going to be looking for somebody to support them. I was like, yes, that's my chance.
Yeah.
Dive again. So I do lunch with these guys, and they're from Israel. And I was like, I love it. They show me this device, it's a handheld device, a colposcope, and it had a software in it. And so for those who know what colposcopes are, traditional colposcopes, they are massive. They are huge. They're these huge devices that are put in hospitals, and they are not portable, and they are used for diagnosing cervical cancer. And it's a super expensive procedure. So this Israeli company has now shrunk it down to a small handheld device on which you clip a phone. Yeah, you clip your phone on the device, and it has a camera. And this camera is zooming in, being able to take images of the cervix. And then these images
Wow.
are being transported even to doctors as far away as Israel or the US. And then
Wow.
the nurses here who are doing the procedure are getting support, like decision
Mm.
making support.
Mhm.
I was seated at that
Wow.
lunch saying, this is it. Rahel, by 3 a.m. that night, I had written a go-to-market strategy.
Oh,
I remember I
wow.
emailed them at I emailed them at like 3 a.m.
Yeah.
I was like at
Yeah.
GlaxoSmithKline, there was a brand representative for Augmentin, and Augmentin, we used to work with obstetrician gynecologists. So I said, I have contacts with all these obstetrician gynecologists, I have contacts with all these doctors and all these nurses. Here is your go-to-market strategy. The next day, they invite me back for a lunch, and we sign a contract at the
Wow,
lunch.
Dinah.
And this
Wow.
is like my fun story of how in
Yeah.
2013 I now got into digital health, got to understand, issues like wearables, Internet of
Mhm.
Things, artificial intelligence, machine learning. I was like, this is so amazing. And I
Yeah.
decided this is gonna be my career path. It's digital health for me.
Oh my goodness. That is such an interesting story. I've never had you saying that before, had you giving that
Yep.
story before. That's such an interesting story. So you sort of fell into it in a sense, yeah? And then it
I fell
became
into it because,
yeah.
because
And
of
then it
that
became a
background, seeing
passion.
these guys in Washington,
Mhm.
D.C., and I was like, this is so fun. Especially
Mhm.
this part where this guy was talking about, we are here in D.C., we are supporting nurses in Cameroon.
Yeah.
You're thinking about that whole entire transatlantic flight. You don't
Mhm.
have to go anywhere. You don't have to leave your country or your village. You're connecting with people on another continent. I was like, this is the substance of magic. This is the stuff, if you had
Wow.
told people in the 18th century, they would have never believed you.
Yeah. Yeah.
Yes.
How do you think, or I mean, in terms of adoption in this Kenya
Mhm.
healthcare industry, in Kenya's healthcare industry, do you think the adoption is to the level that is good enough for us to be able to address all these gaps in the market, all these issues and the challenges that are there that can be addressed by digital healthcare? Do you feel like the
Mhm.
adoption is there? Are we early adopters? Are we late adopters? Are we laggards? I don't know. How do you feel? Because you've interacted a lot with a lot of these stakeholders, whether it's in the government, with governments,
Mhm.
with the private sector, public sector. Do you feel like the adoption is there, or people are still trying to get used to it, trying to understand all these things, Internet of Things, e-health, m-health, telehealth? Do you feel like the
Mhm.
adoption is to the level that is good enough for us to actually for whoever needs to address these particular issues? Do you feel like it's there or it's
Mhm.
still lagging?
So I'd say that the willpower for me this last decade watching is there. I'm
Mm-hmm.
happy to report there's nowhere where I've gone with whatever number of technologies I've gone with and been shunned or be told, no, we are not willing to adopt this. Actually, people are very eager to do it. But Rahel, the challenge is the infrastructure. The challenge is the infrastructure. When you look at the WHO 6 building blocks of healthcare, leadership and governance is one of the building blocks. And I find that unless there's a lot of political goodwill in building the infrastructure that will enable digital health, we are going to keep on lagging behind. So you look at, for instance, in Tennessee, there's a town called Chattanooga. And Chattanooga is now called a giga city because the mayor and the leadership of the city have made sure that everywhere across Chattanooga, there is giga speed of internet, wherever. Whether you're in the park or you just have internet access across the entire city. So majority of these technologies, like I said, are over the phone, which means either you need connectivity through SIM cards, or you need data, or you need Wi-Fi. So I'd say in terms of the people, the stakeholders, whether government, private sector, civil society, or the patients, they are very willing to adopt. But then here comes the challenge of how do you work with that lack of infrastructure? So I feel like up until we get to that place where we resolve that issue, we're going to keep on lagging behind. But it's not for a lack of the willingness to adopt. It's a challenge of the infrastructure.
Yeah, and I hear you on that, and I've heard that from a lot of people who actually say the infrastructure bit is what is required for us to move to the level that is required for us to have this a bit how do I put it, like ubiquitous, like it's everywhere, it's not just in specific areas or the urban areas only, and it's not in the rural areas or low income areas where people cannot even afford certain basic needs, like even just getting a bundle, which is very expensive for them. So Dinah, let me ask, and I know this might be a hard question, but let me just ask, who's responsible for this infrastructure? Is it the government? Is it private stakeholders? Who is responsible? Because we need to move from saying that this is a problem to actually getting a solution and then implementing what is required to be implemented for us to realize all these things that we've been talking about. So who's responsible, according to you?
That's like a really, really good question.
Yeah.
So I have one answer for this. Entrepreneurship is an answer for everything, Rahel. Entrepreneurship. If we say this is the responsibility of the government, that's putting a lot on the government. Like what? There are countries where the government is well resourced enough to be able to do that. You look at countries like Estonia and you are countries like Finland. But then we have to remember, these are very old democracies, very, very old democracies. So we have to be very patient with ourselves and say, we are celebrating how many years after Uhuru, like not Uhuru the president, but after, after independence. After independence, like we are a very young democracy. So if you look at the strides we've made so far, we are doing fantastic. We need to celebrate it. But if we want to have this infrastructure in the middle of Baringo, in the most remote place of Lamu, we will have to open up entrepreneurship. And so this is where it comes in as a two-part tripartite or bipartite arrangement where government is working with the private sector. So what government should do is facilitate the policy framework and reduce the amount of red tape and bureaucracy that any entrepreneur would want to do. I'd like to report that this is something that we have tried to resolve. I met an organization, I'll not say their name, who they try to bring internet to remote places, and they put up the infrastructure, the beams. So they're trying to put internet in schools so that students can have e-learning. They're trying to do it in hospitals. But if you look at that process that they have to go through just to do that, it's completely discouraging. So I find that they did very little work in Kenya, but they're doing a lot of work in Rwanda.
Yeah. Okay.
So I find that for the government, it's about that policy framework, that sense of celebrating these entrepreneurs who are coming with these ideas and facilitating them. Even issues like give them tax rebates, saying that if you're going to come here and you're dealing with these issues of infrastructure, connectivity, we can allow you this government land to set up your beams or whatever you need to set up. We are not going to charge you taxes. Your paperwork is on one portal. You just need to go to this one portal, load all your documents. When you do that, Rahel, we will approve your documentation within X amount of time. If the government did that, believe you me, we are not short of entrepreneurial organizations that can resolve these issues. So the issue of infrastructure will require goodwill from both parties, that the entrepreneurs will persist and the government will support.
Yeah,
Yes.
and I agree with you. And I mean, Dinah, we are talking about the solutions, and we know there are a lot of solutions in the market currently, and more are
Yes.
coming in. But then
Mm-hmm.
you can have all these solutions, but then there's no goodwill from the people, from the end
Mm-hmm.
users, from the people who
Mm-hmm.
would benefit from these solutions, you know, from the
Yes.
consumers, the
Yes.
customers, or however you would call them. And I
Mm-hmm.
believe one thing that is required for these
Mm-hmm.
individuals to move from what they are used to, the legacy systems, they have
Mm-hmm.
there's a lot of change management that needs to happen. I don't know
Yes.
what you think about that in terms of, you know, making people feel like, okay, this is actually something that we need, because there's a lot of education that needs to go into it, sensitization and all that. But then change
Mm-hmm.
management is also a big thing. But I don't know what you think about all that.
So I agree with you because, and I think we had this conversation in the past where I told you,
Mm-hmm.
like, now you can see my voice is a little bit scratchy. I
Yes.
think I'm going to be getting a cold. As
Mm-hmm.
much as even I am a founder of a telehealth company, I
Mm-hmm.
will most likely not think about going on the platform to talk to a doctor and access my medication. My mind is always in my neighborhood pharmacy where I have a very good relationship with David, the pharmacist. And I'm likely to just walk there and say, David, you know, I've been having this thing and my voice is a little bit scratchy. So
Yeah.
I hear you with the sense that we are so stuck in what we are used to doing. If it's going to that neighborhood pharmacy or that nurse-owned facility in our community, that's what we do. That's what our mind is set at doing. So, like you said, there are so many solutions, so many telehealth solutions. And in the sense of change management, I feel like a lot of work has to go in sensitizing the public, especially in terms of trust. I find that for digital, everything digital, what I find with when you have conversations with users is trust. Can we trust that this works? Can we
Yeah.
trust the person on the other end is verified? Can we trust
Mm-hmm.
that you will do what you're saying you will do because we don't know you, we can't see you, you're behind a
Yeah.
screen.
Mm.
But one of the other approaches I'd like to mention, Rahel, is that digital health companies now in the beginning have to structure their approaches in such a way that you're not investing heavily in changing the mindset or the habits of the user, but that you're aligning your technology with that user. So, for instance, when I work with organizations, I try to tell them we have studied over this decade and seen the pharmacy is the first point of care for community health. It's not even the hospital. The pharmacy is the first point of care. So instead of trying to come in the community and saying, oh, you know, get on this telehealth platform, why don't you go and work with the pharmacy so that the pharmacist is the prescriber of your solution? You know, so the pharmacist is telling Mama so and so, thank you for coming with your child, you know, who had this fever and whatever. Next time, instead of coming in here, you know, can you use this platform? Can you use this platform? You'll be able to access a doctor and you will be able to bring your script to the house. So I believe that as the founders and as the developers of the solutions, we have to go to the patient or the beneficiary where they are and move with them in that journey, right? Instead of standing over here and the beneficiary is over here and you're telling them, come over to my side. I believe that it has to go to where the beneficiary is and move with them along that continuum of care until we have won their trust and changed their mindset about digital solutions.
And whatever you're saying is on point, because I was in West Africa some time back, and that's the same sentiment that was shared by some of the healthcare stakeholders there, that the first point of contact is the pharmacy. So even for all these organizations that are trying to build all these brilliant solutions in the digital health space, they need to first understand the market and how the users
Yes,
interact with, you know, such things.
exactly.
And when they have a particular healthcare need, where do they go to first? Who do they trust to give them the right information so that they get well? So I totally agree with you. And speaking about, you know, Africa, and the impact with digital health solutions, what is the impact that you, as Dinah, as a digital health specialist, what is the impact that you'd like to see with all these digital health solutions, and not just telehealth, there's e-health, there's mL, there are so many digital health solutions. What is the
Wearables.
impact? Yes, wearables. What is the impact that you would like to see in this space?
I think all what we are trying to do is better outcomes for the patient. better outcomes for the patient. We want to reduce these issues of mortality that we are reading about. Can you believe to date people are still dying of things like anemia and diarrhea? Things that in 2022 people should not be dying of. And so our issue with bringing forth these digital health solutions, we are trying to work towards a better outcome for every patient. So let me give you an example. Without digital health solutions, so think about a patient who is in not even too far away, Nyeri or Muranga, and is a cardiac patient. Let's say maybe they have a previous myocardial infarction. They are now having, as men grow older, they suffer from a condition called BPH. So this patient has comorbidity of BPH. They have diabetes, they have hypertension. So this is a person who is supposed to be seeing a cardiologist, a nephrologist, a urologist, a physician. They're supposed to be managing their care under a multidisciplinary team. As it currently works, Rahel, this patient has to come from Nyeri, Nanyuki, Narumoro, Muranga, or wherever, assuming they're receiving their care in Nairobi, which is where majority of the specialists are located. They are told cardio clinic is next week on Monday. They get on a matatu and they come and they see the cardiologist and get their drugs and then they go. 2 weeks later, your visit with the nephrologist. I have come to realize, Rahel, majority of these matatus that are moving between up country and Nairobi, if you are to do a poll, they are carrying patients coming to the city for care.
Wow.
When you look at the amount of money that families spend porting their parents back and forth, or their relatives, to just come and access specialist care, access imaging. So you're looking at things like maybe in Nyeri, you're looking for an echocardiogram. It's really difficult to find or it's expensive. So you realize here at a government level 6 facility, you can get it for 1,500. Patients are just moving back and forth trying to access care. And so when we look at matter of outcomes, you're looking at, can this patient now get, like in a meeting like what we are doing, Rahel? I could be the patient and you're the doctor, and I'm telling him, yes, this is how I'm feeling in my body. Can they have point of care devices in their home? Can this patient have a glucometer and a blood pressure machine, and they are monitoring themselves and recording or uploading it on a device? Or if I may mention, like one of the companies we are in touch with now called Bodyport that we are trying to bring to Kenya, they use a simple weighing scale machine, like a normal weighing scale. When you stand on it for about 6 seconds, it's measuring your hemodynamic biomarkers. It's telling you what's your fluid retention, what's your heartbeat per minute, this is Internet of Things. And as you're standing on this weighing scale, it's alerting your doctor how your kidneys are functioning, how your heart is functioning. Rahel, look at these kinds of solutions and compare with this. This patient has to come from Narumoro, come to KNH or something, go back, come for this clinic, be told that they need these tests, travel just to come to the lab. Oh my goodness, this is what digital health is supposed to do. And I've come to believe that digital health will have to go hand in hand with devices, especially point of care devices. So that's something that I'd like to put out there to the audience, that digital health will have to go hand in hand with point of care devices so that we can also resolve one other issue, Rahel, and that's the issue of empirical treatment, which is what we do in Africa. And empirical treatment is where doctors treat you based on history of what they've seen over the years. Like, for the last 10 years, every patient who came in with a fever and this has malaria. So I think that you have malaria. I think that you have typhoid. We need to come towards evidence-based care, where we are using lab tests and we are using imaging to diagnose our patients. So that's the reason why I say digital health will have to go hand in hand with devices.
Wow. You have such knowledge. Some words I'm learning, empirical. I know.
It's true. We do have to be, Africans are orators, Rahel. Yeah. Look at us. We enjoy conversations. And traditionally, that's how we treat patients. It's empirical. It's like, how are you feeling? Yes, historically in this region, if people are feeling this way, this is what you have. And you miss it. This is how we have so many cases of undiagnosed renal disease. Because we are diagnosing renal disease as completely different things. We are not doing any blood measurements.
Yes. Yeah. Wow. Awesome. I really love that. So as we come to a close, as Dinah, what are you doing to influence this conversation to not just be a conversation, but to actually actualize it or realize it in whatever capacity, whether it's in the community, whether it's in the urban area in terms of convenience? I've heard you talking about being a founder of a telehealth solution. So what are you doing as Dinah to move this from a conversation to reality?
That's a fantastic question. I'm happy to talk about it. So I stopped about 3 months ago and asked myself, it's really been 10 years. Why don't I stop and take stock? What have I seen in this last decade? So that I can be able to reflect and ask myself what needs to happen for the next decade to move us further down the road. And so the first thing that I realized was that we needed to come together. We needed to come as stakeholders in this healthcare ecosystem with all our expertise. We need to come together, meet at the table, and say, "What have you seen? What have you seen? What have you seen for this last decade?" So what I did is I am now the Chief Visionary Officer of the Africa Digital Health Consortium. And I love it. I love it because it just started with faith that I was going to reach out to anybody in this space who was a digital health expert or was doing any kind of work within digital health and ask them, hey, I have a vision to build this consortium. And what we are going to do is advocacy, collective action, and thought leadership concerning digital health. We are going to drive the agenda for where we want to see our country moving in terms of health for the next decade. Do you want to join me? And I got 135 yeses within 3 months. And I was like, wow, this is amazing. So what we are doing at the consortium is bringing together experts to begin addressing these challenges that we are talking about, our own homegrown solutions. And in addition, Rahel, you would ask me what else I'm doing as a person. I'm asking myself over this decade and all what I have learned, keeping this information to myself is no good. So we are raising up young homegrown companies, and in the consortium now we have 12. Yesterday evening, we added a 13th one in Kenya. We are reaching out to these young people who are building solutions and telling them, we're going to surround you with expertise. We are going to sit as board members. We are going to be your advisors. We are going to give you network and connections in the industry that can move you further along. So that's what I'm doing. I'm now passing the baton to the next generation and trying to guide the thought leadership. And thank you very much, Rahel, again, for just being part of the consortium. You're one of the people I have to mention who I reached out to and said, okay, this girl, she's so good at what she does. We are going to need you to bring your expertise. And you've come on board and helped us to structure the consortium. So thank you so much for that. And then in addition to that, I also built a telehealth platform called Doctors Explain, together with my co-founder, Dr. Levi Cheruo Choptora. And the reason why I built that platform was I saw a need or a gap in the solutions that were already in the market. And I said, well, you know what, let's do this our way and try to address this gap and see what impact we'll be able to over time. Yes, so I'm a co-founder at Doctors Explain, a chief visionary officer at Africa Digital Health Consortium, where good people, I'm happy to report, Rahel Musyoki is helping us with the strategies. Yes.
Oh, wow, wow. I love it, Dinah. I really love it. And let me just mention this, when I met you, the breath of fresh air, it was just something to behold. And I'm really glad to be, carrying this vision with you. And I'm looking forward to seeing it move from what it is right now. Right now, we are creating a foundation and building it up to, the big thing that you have envisioned it to be. And I know with all the people beside you and us, and the vision itself will actually get to that level. So thank you so much for sharing your insights. I really love what you've shared. I've learned something. Definitely, I've learned something. I'm still a bit young, I will say, in this field, but I'm really, really learning a lot. And I'm glad that I have you and other people on the side just, pushing me forward. And, this thing will actually become a reality, and it will become even bigger because it's more about other people, not about us, but about other people. And, addressing this gap of affordable healthcare, accessibility to affordable healthcare. So thank you, Dinah. Thank you. I really appreciate you. It's such an honor to have you on the show. Thank you for sharing all that you've shared today. Thank you.
Thank you for having me.
Awesome.